What does PCOS stand for? What is the full form of PCOS, or what does PCOS mean? It stands for Polycystic Ovarian Syndrome. Polycystic ovary disease is a syndrome of multiple irregularities of the female reproductive system. It includes abnormal functioning of one or both ovaries. The cardinal features of hyperandrogenism, in which a female has increased male pattern of characteristics, and polycystic ovary morphology, are seen on ultrasound with multiple small cysts on the affected ovaries. Polycystic ovary disease is one of the common abnormalities of reproductive age group females, where its prevalence seen on ultrasound is around 25% of all women, but it is not always associated with the full syndrome. Women with this disease are more at risk for various other illnesses, such as cardiovascular problems and diabetes mellitus. It affects around 5 to 10% of women of the reproductive age. The etiology of polycystic ovarian disease is not completely clear. Although the frequent familial trend points to a genetic cause, some of the signs and symptoms that can be seen in various patients include following. Elevated serum LH levels and raised insulin resistance are common features. Decreased or absence of menses, as seen in up to 75% of patients, is predominantly related to long-term anovulation. Hirsutism that includes increased male pattern of body characteristics. Subfertility is seen in up to 75% of women. Obesity in at least 40% of patients. Acanthuses nigricans, which are the areas of increased velvety skin pigmentation in the axillae and other flexures of body. Some may be asymptomatic. A patient must have 2 out of the 3 features below for a proper diagnosis of polycystic ovarian disease. First, amenorrhea or oligomenorrhea, that is decreased frequency of menstruation or absence of menstruation. Secondly, clinical or biochemical evidence of hyperandrogenism, that is increased masculinizing hormones. And the third, polycystic ovaries seen on ultrasound. The criteria for the diagnosis of a polycystic ovary are 8 or more cysts lesser than 10 mm in diameter. Polycystic ovarian syndrome can be a reason for infertility, but it is a very treatable cause of infertility. Having PCOS does not necessarily mean a woman can't get pregnant. With proper management, or its symptoms, it is highly likely to get desired results. Many people have this misunderstanding whether it is curable or not. Unfortunately, there is yet a cure to be found and no proper cure is available at the moment. However, patients can live a normal life by management of its symptoms throughout life. Following is a diet chart sample for patients with this syndrome to help control associated symptoms. Management and treatment of polycystic ovarian disease combines various approaches. It includes lifestyle changes, medical treatment and surgical treatment as well. Lifestyle advice is a dietary modification which is appropriate in these patients as they are at an increased risk of developing diabetes and cardiovascular disease later in life. Aerobic exercise has been shown to improve insulin resistance. Weight reduction helps a lot in this regard as well. In terms of medical treatment, doctors can prescribe combined oral contraceptive pills and GnRH analogs to regulate menstruation, and the medication for the management of androgenic symptoms, diabetes, and cardiovascular risks as a supportive therapy. Surgical correction involves ovarian drilling, a laparoscopic procedure to destroy some of the ovarian stroma that may prompt ovulatory cycles. Other surgical treatments include laser or electrolysis.